Good evening, and my name is Misha. The project that I have chosen is Tobacco Cessation in Teens. The need to reduce teenage smoking has become increasingly important because of the long-term health conditions such as heart disease, cancer, hypertension, and other secondary problems. Tobacco smoking is a large part of the United States economy despite its the risk it poses to smokers and secondhand smokers. According to Mermelstein, researchers and practitioners acknowledge the high smoking rate among adolescents and low probability of cessation on their own. The younger the age they start smoking is the more adverse effects that it causes. There are many factors that will influence cessation of smoking in teens. Due to the vast cultural differences and rural and non-rural areas, genetics, economic status, as well as gender differences, the study will have an integrated approach in an aim to diversify the program. The focus of this research is the efficacy of not on tobacco cessation program and finding ways to enhance the program. The target of the study is age 14 to 19 who are enrolled in high school. The aim of the research then is to find areas of the current not on tobacco cessation program that are effective and highlight them, and to modify the areas that are not as effective, presenting teens with a program that is both customized to their needs and readily available via in-person and over the internet. Now let us look at some of the determinants of health. This research will shine a light on the severity of nicotine addiction in teens. According to Mermelstein, one of the reasons it is difficult for adolescents to quit smoking is due to nicotine dependence. Preliminary studies have shown the rapid dependence in as short as 1 month. This addiction can be linked to their genetic build. According to Horn, factors surrounding youth from rural areas who are less educated and impoverished start smoking earlier, higher smoking rates, and have a higher risk of developing smoke-related mortality or morbidity than others from the non-rural areas. Gender-related issues also play a huge role in tobacco cessation, as female cessation rates on the Not on Tobacco program was significantly higher than that of the male. The approach, however, has to be different in each gender, as male and female don't respond to the same manner when presented with the same information in the same format. The target population is adolescent, specifically 14 to 19 years. Therefore, the approach have got to be in a manner that they can relate and will receive. Along with the personal approach, the use of technology via the internet-based approach can be incorporated in this group, presented in an appealing form. This also provide round-the-clock support so they have the necessary information at their fingertip. One of the limitations in the NOT study conducted in the West Virginia and North Carolina was the inability to contact over 50% of the student for the 15-month follow-up. The internet-based approach could significantly reduce this number, as this can be made in the format of an application that teens would also log in, check and monitor their own progress, and set goals for themselves. Tobacco use have become a grave concern in the community because the users and the secondhand smokers are both at risk for developing severe health issues. Studies have shown that teenage smokers, if allowed to continue, will have high mortality rates and adverse health concerns. Due to the rapid increase of smoking in low socioeconomic status community, and this group is heavily dependent on government assistance for healthcare, this could pose an increase in healthcare related costs. Smoke addiction can be significantly decreased with education and campaigns geared specifically towards teens. Most teens started out recreationally, which lead to their addiction. So, creating awareness could discontinue this practice and reduce the overall usage of tobacco in these communities. Now, let us look at the infrastructure. Not on tobacco was an intense six-study program conducted in the United States. It compared 44 schools data that had enrolled in the program. The NOT program uses principle of social cognitive theory. The key developer of the program was the American Lung Association. To develop this program, the ALA partnered with researchers at the West Virginia Prevention Research Center at West Virginia University. Kimberly Horn and Gary Dino are associate professors of community medicine at West Virginia University. They were the key researchers of the NOT program. The program was funded by the West Virginia Research Center in collaboration with the Center for Disease Control and also the National Institute of Health. Their role was to find an effective program for teens that could be implemented in schools and could be accomplished within the school year. They determined this could be a 10 weeks, 50-minute cessation program with 4 optional booster sessions. The role of the ALA was to train the facilitators based on the ALA standards and provide volunteers for the program. The staff for the NOT program were adult facilitators trained by the ALA staff, volunteers, and principals. Some of the other professionals listed were intricate to the program were school nurses and practitioners. The sessions took place at meeting spaces within the schools. The partners were the school district and the ALA. Due to the overwhelming increase in tobacco smoking in schools, the schools agreed to facilitate this process. The areas of interest were urban, rural, and suburban areas. The stakeholders were the program manager and researchers. Because there are only a few tobacco cessation programs with a low success rate, a lot was weighing on this program as there is a real need for cessation in teens. The concern for the increase in cancer and tobacco abuse related disease and illnesses, the National Health Institute would have found value in this program and a solution that could be implemented in the school system, one that produced credible research data, process, and systems backed by the ALA. Now let us look at the ways we would deliver this program. Our teens are definitely the future of our country. Smoking takes away the dream of a long and prosperous life due to low life expectancy and chronic illnesses that are associated with smoking. One of the devastating facts about smoking is secondhand smokers are at risk for some of the chronic illnesses that are associated with firsthand smoking. In most states, it is illegal for minors to obtain cigarette. However, they still manage to get their hands on these deadly poison. The aim then is not to try to hide cigarette from these minors, as studies have shown that children whose parents smoke had a 10 times higher probability of smoking. They have access in their homes, consenting adults willing to purchase cigarettes for them, and small stores that are willing to sell them cigarettes. Our job then becomes to take away the appetite of cigarette smoking from our teens. The NOT program requires very minimal community involvement. It does not divide the community resource, and the program instructors are simply on a volunteering basis. The only negative that this program does to the community is outline the reality of how many of our teens are actually chronic smokers and tobacco dependent. Most parents would like to see their children in better health, socioeconomic, and more educationally advanced than themselves. According to the CDC, there is a strong correlation between frequent smokers and low academic achievers. The message that would be promoted in the community is reducing tobacco smoking in teens will improve their health physically, mentally, and could potentially improve their academic grade level. The improvement that would be added to the program was online support would provide as needed maintenance in a way that is appealing and user-friendly to the teens. One way we could get the community involved is to have volunteers get training from the American Lung Institute and become counselors. This provides the means for them to actively participate and pour back into their community. Now, let us look at some of the politics and the ethics behind this program. The current Not on Tobacco program requires testing of tobacco at 3 months and 6 months carbon monoxide testing. Since this program age range include predominantly minors, 14 to 19, it is important to check the various state regulation on testing minors for research purposes. The state of Florida stipulates that legal consent should be given for minors 18 and under, unless dependent status have been removed by the circuit court. Also, if the minor is married or pregnant, they can make this decision since it's in the best interest of their unborn child. Other ethical concerns are youth should not feel pressured or compelled to complete the program within the time frame, as every child is different. This may negatively affect the results of the research, but the integrity of the research should not be compromised to boost the success rate. Some youth, due to genetics or the initial age of starting to smoke, may also need additional assistance of medical help. The aim of the research should be geared at helping teens, and hence, even if it weakens the hypothesis, should aspire to get the right treatment and program to the teen based on the needs. Studies have shown that a lot of teen smokers use this as a coping mechanism to deeper issues. If it have been identified that there is abuse or a crime being committed against the teen, this should be reported to the authority, even if it may cause the teen to drop out of the program. The method of selecting the teen is specific rather than randomized. It is important to diversify the research by not only selecting groups and populations that are more likely to quit. The study should be equally performed in all areas as well as socioeconomic status. The same level of excellence should be given to all areas, even if aspects of the research must be customized to their needs. Opponents to the program could be members of the school district. While the names of the student must remain anonymous, the smoking rate at the school will become public knowledge and cause the community to view the school in a negative way. The tobacco industry is a large part of the economy. While it is illegal for a majority of these minors to purchase and smoke, they are a large percentage of the revenue of this economy. This is a slippery slope. However, according to the CDC, nearly 9 out of 10 smokers had their first smoke at age 18. This could reduce tobacco use significantly now and decrease the overall, as these teens may not convert to chronic adult smokers. Tobacco use, according to the CDC, is higher in low socioeconomic status population. There is a lower cessation rate among this population. This is a great need for the program for the teens to discourage, educate, and introduce cessation process. This will decrease the number of lung and heart disease, lowering the cost of health care to the federal government. This will also, in the long run, lower the cost of research for the increase in tobacco-related chronic diseases. At the current rate, a lot of our teens would not quit and will become chronic smokers. The program was developed for all geographic area and socioeconomic status to create a national culture of smoke-free environment. Teen smoking may boost the tobacco industry, but it cripples the health care, including private and government-funded insurance. The program is volunteer-based, hence it eliminates the bias of respecting a profit or financial return. In concluding, the NOT program was successful because of its customized approach. The program provided instructor-led classes that were trained by the American Lung Association standards. This program was readily available to teens as it was offered through their school program. Some of the benefits were accountability through 3 months and 6 months tobacco testing. The group consisted of teens from very similar socioeconomic status and smoke habits. A follow-up at 15 months was also done to check with teens to see how they were progressing. The program is led by same-sex educators, which create an environment for teens to freely speak about not only their addiction, but also personal issues that could be related to their addiction. The short-term effects of this program may not be as positive as the overall potential of the program. With any new system comes with a phase of trial and error and the opportunity to increase the efficiency and the effectiveness of the program. There might be issues with withdrawal where patients may need additional medical help that is not covered by the program. The long-term effects is very promising. Reducing the overall smoking rate will decrease not only first-hand but also second-hand smoke in schools. This will decrease the overall health risk factors such as cancer and cardiac issues. The program is very detailed and diverse and have been researched in rural and urban areas with great success. The scalability of the program have both pros and cons. The program is able to be reached to broad audience and in its group setting can reach a lot of teens. However, this may come at the expense of losing the customizable approach and the individual touch that it provides on each student. It is also instructor-led on a voluntary basis. Hence, this will depend on the volunteer pool in the area and the class size they can effectively lead. This program can definitely be improved and upgraded with the use of technology via internet, as this will allow also counselors not in their geographical location to answer questions and give advice. Thank you so much, and this was my presentation.